Hi, my name is Abria Bennett, and I'm a student nurse at the University of South Alabama. Today, I'll be performing the abdomen assessment, and I will begin by performing hand hygiene. The next thing that I will do is I will knock on my patient's door. After entering into my patient's door, I notice that my patient is in supine position, my patient's knees are bent, my patient's arms are beside his side, and my patient has a pillow under his head. I will then ask my patient 2 questions. Have you emptied out the bladder?
Yes.
Okay, my patient has emptied out his bladder. I will then ask my patient, does he have any tenderness? Do you have any tenderness before beginning this assessment?
No.
Okay, and I would also like to acknowledge that in a real hospital setting, my patient's exam table will be up to waist level, working level. I will then begin to describe my patient's skin. After describing my patient's skin, I will note the color. The color on my patient's abdomen is slightly lighter than the color on my patient's arms and on my patient's legs. I note that my patient does not have any lesions. I'm noting that the hair on my patient is coarse-like and going upwards. He has fine bill. And I would also like to note that my patient's umbilicus is midline and it is also inverted. The next thing that I'm going to do is I'm going to describe my patient's contour as well as my patient's surface movements. Okay, my patient's profile is convex. My patient does not have any pulsations. My patient does not have any distension, any hernias, or any peristalsis. The next thing that I will do is I will auscultate my patient's 4 abdomen quadrants using the diaphragm of my stethoscope. Okay, after auscultation, I would like to note my findings were normal active, which means that my patient's pitches were very high and they were frequent. I would also like to note that I would hear sounds of cascading and gurgling, and also I would hear between 5 to 30, I would hear this between 5 to 30 times per minute. I also observe for any hyperactivity, which is high pitch and loudness, frequency, and I would also like to acknowledge that I would hear tingling and any rushing, and this sound is heard more often than normal active. I also observe for hypoactive, which is quiet sounding, and it is free and frequent. I would like to acknowledge that in the auscultation, if the sounds were absent, I would auscultate for 5 full minutes. The next thing that I will do is I will then begin to auscultate for my patient's arteries. Would you hold your arms upward, bending your elbows? And this I will do using the bell of my stethoscope. Beginning with my patient's abdominal aorta. And now moving on to my patient's renal artery. And now moving on to my patient's iliac artery. I would like to note that my patient did not have any bruit sounds. The next thing that I will do is I will begin to percuss my patient's abdomen in the 4 quadrants, looking for any abnormal findings. Okay, after percussing, what I did find is tymphasis, and for most of the part, and what I did find was slight dullness, and it is most common that I will find these readings after my patient has had breakfast. What I will then do now is I will move on to the palpation of my patient. As I begin to palpate, I will look for muscle tone and also surface character with light palpations. Okay, do you feel anything? Any tenderness or anything? My patient has good muscle tone and good surface character. I will then begin to deep palpate for any tenderness and any masses. 5 to 8 centimeters. Do you feel any tenderness? Okay, my patient does not feel any tenderness once again, and I did not know any masses. The next thing that I will do is I will begin to palpate the border of my patient's liver, and I will ask my patient to inhale and exhale. As my patient exhales, I will begin to palpate. Okay, I will hold my hand this way, and I will begin to palpate the border of the liver. I will ask you to inhale. Now exhale. Inhale. Now exhale. Inhale. Now exhale. Okay? I did not palpate the liver. The next thing that I'm going to do is I'm going to palpate the border of my patient's spleen. I will hold my hand this way towards my patient's axilla, and I will begin to palpate around the border of my patient's spleen. Doing the same method, I will ask my patient to inhale, and I'll begin to palpate as my patient exhales. Could you inhale? Now exhale. Inhale. Now exhale. Inhale. Now exhale. Inhale. Now exhale. Okay? I did not palpate my patient's spleen. The next thing that I will do is I will percuss for my patient's CVA for the kidney tenderness. I will ask my patient to come to the edge of the bed. Okay? I will do a light tapping on the back. Would you mind holding your shirt up and let me know after I'm finished if you feel any tenderness? Any tenderness?
No.
Any tenderness?
No.
Okay. This will conclude my abdomen assessment. Thank you.